M. Honudgi sir, Medical Superintendent of Sri B.M. Patel Medical College Hospital Research Center, and he is also Vice President of Association of Physicians of India Karnataka Chapter. Also Dr. Sanju N. Benchur, who is the Head of Department of Medicine. And I welcome all the postgraduate students, undergraduate students, interns, and other faculty members to this guest talk on a very important topic, smartphone technology for healthcare professionals. Friends, the Geriatric Clinic is organizing today's guest talk on smartphone technology for healthcare professionals. As we are using many gadgets, but not to the full potential which they are meant for. This COVID-19 has opened many channels wherein the complete usage of various gadgets in providing solutions and providing healthcare has been established. But still, I feel we lack a lot of use of the mobile phone in the health services. The healthcare professionals need to upgrade the best utility of smartphone. In this regard, we have eminent physician and a very active physician from Mumbai, Dr. S.V. Kulkarni, to share his experiences. I welcome you, sir, on the behalf of BLDE University family. We are privileged to have you on this board. Welcome to you, sir. Now I request Dr. Rajesh M. Honudgi, sir, to declare the program open. Dr. Rajesh Honudgi, sir, is the alumni of BLD deemed to be university. He pioneered in starting dialysis unit in Vijaypura. He is the Vice President of Alumni Association of BLD University, and he is Vice President of Association of Physicians of India Karnataka Chapter, and presently serving as Medical Superintendent of Sri B.M. Patel Medical College Hospital and Research Center. Over to you, sir.
Good evening, sir. Good evening. Good evening. Good evening, my dear friends, Dr. Anand Amli and Head of the Department, Dr. Bentu, sir. First of all, I take this opportunity to thank the organizers, Department of Geriatric Medicine and Department of Medicine, BLD Sri B.M. Patel Medical College, for giving me opportunity to inaugurate this very good lecture at this time, because as you all aware that we were using mobile phones earlier, but this COVID-19 has shown us to use in a different ways. What all ways we can use our smartphones for the benefit of us and also other patients. So this is a very important juncture of our practice. Even MCI and NMC has approved telemedicine as one of the tool for consulting the patients. It has approved officially. Initially, telephonic, even WhatsApp and all those prescriptions were not approved. But nowadays, because of this pandemic situation, the use of telephones has been approved. Now we are we are lucky to have you, sir, Dr. Shriram V. Kulkarni, who will tell us the various uses of mobile phones for healthcare professionals. I again take this opportunity to declare open this guest lecture. Thank you, sir.
Thank you, sir. And now I request Dr. S.V. Kulkarni, sir, to start his discussion. And any questions you can please drop in the chat box. Thank you very much, sir. Please proceed, sir.
Thank you, Dr. Anand, Dr. Rajesh, for all your efforts to start have this presentation for all the medical students of your medical college. Are the slides
and
visible?
Now I request Dr. S.V. Kulkarni, sir, to start his.
Anand, whether my slide is visible or
slide is not visible yet.
Okay, I'm just going out of the view.
Okay.
And reconnecting.
Okay, sir.
My slides are visible.
Just a minute, sir. I am facing a problem here.
So I just stop share and I start resharing.
You are visible, but
yeah, slides. I will start with the slides again.
Yes, sir.
So this
Yes,
is the
sir.
opening slide. Thanks for all your good efforts. Friends, we are going to have a very friendly discussion on something which is very close to all of us. How we can use best way role of digital technology in modern medicine, especially in the COVID era. Dr. Anand was very friendly and very kind enough to introduce me. I'm right now in Navi Mumbai. I'm a MD medicine student from Miraz only, and Bijapur, or now called Vijaypur, used to be the a very favorite picnic spot for all of us. There were few conferences which I had hosted. That was MapCon 2013 and APCon 2007 and MapCon 2019. My main interest is in technology, computers, electronic health records, and uses of smartphone in clinical medicine. I can't forget my alma mater, my legacy and roots from Miras Medical College. Right from 1974, it is almost like 45 years, and all these people are supporting us and our group very firmly. Friends, I to confess that I am a Stone Age physician. I got admission 1974, and I cleared my MD in 1982 at the first attempt. But these were the only two instruments which were having X-ray chest and a ECG. No other equipment there. Neither there was the ultrasound nor the CT scan. Then after the times have changed, almost after 40 years, when we are coming to such type of smart cities in
Sir,
and around Mumbai. Anything, Anand?
please continue.
Yeah. I have a few disclaimers. There is nothing to declare in form of indirect or direct funding. There is no source of support except for the love and affection of Anand and your institute. The material, the apps displayed have been chosen by merit and are freely accessible to all. They are all free. Choice, we are not endorsing any hardware or software solution. Education, please do not take photo or notes. Copies can be provided at your request. This whole presentation belongs to you, because then if you start taking screenshots or photographs, then you lose the continuity. You are free, we are absolutely free to share, and do acknowledge us at least as a Society of Medical Smartphone Medical Technology for Medical Sciences, or with my name. The slide can be used in any presentation. There are few more things I want to declare. Friends, technology is always changing. It is very, very difficult to cope up with it. Upgradation is norm. And in this field, there is nobody is perfect. The law of obsolescence prevails. We have to we need to keep the pace. I am in active practice, but out of touch with the neat type of examination pattern and stress of faculty on one particular aspect of clinical medicine. But I'm very sure whatever we are going to discuss in next 40 minutes is going to sharpen your clinical skills in practice, patient care, and increase your techno savviness. This is a really very wonderful opportunity to learn something new. So this is the outline. What we already know. Why do we need technology? How to use technology? What are the basic principle is? What are the different apps, attachments, medical records, and learning resources? What is there in the future, and what can change from tomorrow if you start practicing it in a very nicer, cleaner, and smoother way? People always ask, at the age of 65, why you want to talk about smartphone technology? Friends, in India, medical care aspects are increasing. The technology developing is very fast, equal or more pace. Internet connectivity speed is outstanding. And take everything around us, travel, banking, healthcare is using the least of modern technology. We must thank to telemedicine that at least few doctors are using this Zoom meeting and telemedicine. My whole aim, and that is also in the mind of Dr. Anand and your Vice Chancellor and Vice President of API Karnataka, that we want to introduce, encourage, establish techno savviness in all of you. And may the next generation may be benefited, or even the next generation can teach us. So this is a different aspect of overview of my subject. It is for students, undergraduates. Main stress is on for postgraduates, clinical study, what duty supplements. It is going to help the practicing doctors also. What are the different kind of equipments which you can attach, how they are utilized in practice. how to select an EHR, few tips about telemedicine, and what is the key to the research and different kind of publications. In India, we lack about publications and research, but with this, we can definitely go a step ahead. So I just made the 12 points of a patient management system. You have to communicate to the patient, you have to access to the resource, you have to have point of care documentation, disease management, education programs, professional communication, lot of administration problems, financial. Then in emergency, you need ambulance, you need contact with public, pharma, clinical trial, and your local body network. All these things can be helped by a very simple instrument in your hand, and that is a smartphone. And smartphones are ubiquitous. They are everywhere, right from a baby to a meeting to the seniors, or whether you are in airport or whether you are on a train station, you can see hundreds. And most important for India, the digital vision of India is really focusing, and we are going to be the real masters of digital world if we apply this knowledge in a very, very proper way. You may recall this was the first technology which this person has used, and how the physicians were used to hear the lung sounds and heart sounds. And then came this simple instrument. Now, you imagine your days without a stethoscope. And you see the evolution also from that 1816 small strip, it went to a stethoscope. We had digital, like a digital phone also, from a brick like size. It is now in 220, it is right in your hand. Sometimes you can have two in your hands without notice. And in 2020, you have got a stethoscope which can be connected to the patient without a tube, and you can hear or record the heart sounds. This was first electronic computer that was called as ENIAC, and it was a huge godown in which it was stored with some 152 number of exhaust fans to cool it off. And then after, everything has changed after the World War, and since 1944, the technology is within your reach. Now, why do we need technology? What are the advantages? First of all, it is very quick and at one click. Anand will confirm that his geriatric patient sometimes consume 15 medicines. That can be done with only with Control C and Control P. Data sorting can be done easily. Planning is possible. Repetitive jobs are done faster. In the polypharmacy era, we can get drug interactions. And there is an ease of operating. There is no learning curve. You can empower the people in your department so that the work is divided and the top person gets more time for research and thinking. You can learn at leisure, and most important, you can learn from the next generation. That is more important. This is just our journey. We had started our workshops all over the country since 2012, and we are really going very strong. And our group is known for now technology in medicine and in API. Friends, I'm going to give a cricket team of people whom you have seen around. Just a rapid names of the things: antiseptic hand washing by Seven Davis, germs cause theory by Louis Pasteur, heredity theory by Mendel, newborn incubators in 1903, a theory of virus cancer 1911, balloon angioplasty 76, H. pylori concept 1980, infectious disease protein concept, prion concept 82, traumatic brain injury in sports 2009, and cancer immunotherapy in 2011. If there is something which is common in all these things, that these were the big medical breakthroughs which were initially ridiculed or rejected. And in the words of Barry Marshall, he said that everyone was against me, but I know I was right. That was way back in 1980. And in 40 years after that, I also say that the technology adaptation is the key, and it is the future of our profession. This is what friendly happens exactly once any technology comes in market. There is very less things which have been 100% utilized. There is an innovation, early adaptation, early majority, late majority, and then it goes down. Also, this is the technology adaptation rate of different type of things. Now you can imagine, see the yellow line is of telephones. It went up and up, now it is steady. Auto also is steady. Color TV is also steady. What is going up is only internet, mobile phones, and desktop computers or the laptop computers. So this is the way in which the society adopts any technology. 120 years for telephone. What telephone needed to achieve 100 years, it has achieved in 15 years by the smartphone. What is the most important thing about smartphone technology is also accessibility, availability, and affordability. Everyone has got a smartphone. Many useful apps are available, Android as well as iOS platform. More than 10,000 peripheral devices are available. Most of the apps are free. But I will give a caution, don't buy a free app. There are reasons for that. Learning to use these apps is easier than learning how to use it, Facebook or Snapchat or whatever the social media you are working using right now. A big question is how to buy, use, and recommend an app. So this is a list of C's. You have to identify who has created it, what are the person's CV, what is the center, location, institute, what is the credibility, past track, consumed by how many people, how many users, criticized by how many, and how many times it has been corrected. So please don't believe in healthcare or fitness apps and buy from the approved dealers or vendors. Up to date cost 29,000, and if somebody says that he can give up to date for 1,000 rupees, don't believe that person. So in simple words, don't go get lost into the world of apps, or don't make a paradise out of good things, or a mess out of the good apps which are available. Let us go to the simple one point oriented apps. You have to just go to Google Play Store and find out body mass index. It will give an app. Surface area, various converters of units, SI to metric, anatomy apps for explanations, animations, medical calculators, risk score stratification, pain score, and ACVD, that is the cardiovascular risk assessment. We'll go one by one, but majority of these simple one point oriented apps are now getting obsolete. There is something called as the essential bundled apps, which have got an integration of various features of various apps. It includes combination of disease, drug reference, medical calculators, lab values, links to the articles, medical education, and the latest guidelines. It is called bundles since they are the pack of the features of others, and a physician's smartphone at least needs at least one of it. And these are the big fives of mobile health: Medscape, Up to Date, Hippocrates, who previously it was called as a Skyscape, now it is called as Omnio, and Univadis has been supported by a pharma giant for all the medical professionals. But out of everything, Hippocrates is one very good app. Here you can see once you open, and if you want to search a drug, it asks you for the class, then whatever the emergency or whatever are the departments you want. Then there are drug interferences, there are interaction checkers, and this concept called the pill ID. You can take the snap of the pill and you can identify it is possible only in US. Various calculators are there. There are various tables, and if you want to buy from some particular store, they are connected with it. So this is about Hippocrates. There are a lot of other simple things, like this is for the ACLS, rapid sequence intubation. It tells you everything what you want. It is just like your registrar or your senior resident standing next to you and is trying to communicate with you. In addition, you can go to the subject wise and you can find out whichever subject you want. And you can, suppose if you want to know endocarditis prophylaxis for adults, it will go to that site and it will tell you what details you want. Up to date is real king of everything. That's a bit costly, but let us try to spend something for your education. 100 rupees per day, it should not be a big way, and if you are institute, then you can buy it in bulk, and it is really a wonderful software. Every resident should have this up to date with him. This is about Omnio. It is more or less same, but I got few words more about Medscape. There is no fees or upgradation cost. Many drug references, disease references, clinical images, medical news. There are lot many good things in Medscape if you start using it regularly. So these are the really multifunctional, immediate clinical answers, latest medical news and perspectives, Medscape consult, and CME activities. This is the screen, how it will look: drugs, conditions, procedures, and then interaction checker, calculators, formulary. If you have got your hospital formulary, you can upload it here. For example, you are having a drug like warfarin, then if you click at this, and you will get all the information. What are the things we should do in pregnancy? What are the adverse effect which we know? And most important is the drug interaction. This drug interaction checking is very simple. You have to add a drug, and I had a patient who has had pulmonary tuberculosis and developed convulsions. I just checked it into Medscape, and it shows that rifampicin decreased the level or effect of phenytoin by affecting hepatic enzyme. So significant interactions possible. Either monitor closely or increase the dose of eptoin, because the patient should not get more convergence. This is Unividis from MSD, and you can order the things whatever you want for you. WebMD is something similar, but it is more patient friendly because it helps them to check symptoms, treatment alternatives, and even find the doctors in the area. And if they are whatever the location, the surgeries, timings, and whatever suits, they can fix an appointment on an electronic way. So if you go back, I had suggested you 5 A's. Into that, accessibility, availability, affordability, we discussed. Most important is adaptability, applicability, and accountability. It should be a very trusted and proved application, then only it can be used for medical care. Now, which are the stages of career it helps? It helps in practically every stage: selecting the stream, undergraduate learning, skill development. Those people who are in academics in your institute, it will be for course development. Basic sciences, laboratory imaging, diagnostic, electronic waveform evaluation, right from ECG, EEG to EMG, and even electronystagmogram can be connected into one electronic health records. In COVID time, if you have got problem with clinical teaching, you can have mock exams, trainers research presentation, publication training. You can, now once you become MD medicine and then go out of then how to practice, whether it is solo, group, and there is something called as a practice enhancement, tricks, tips, and traps, which you can learn with the help of technology. You can grow up around, suppose at the age of 65, 70, if you want to phase out or a retirement plan, you can do the thing. And mostly teaching is one thing which is like a art of giving to others, and you can create a legacy with your electronic footprints in the clinical medicine area. So let's go to first MBBS first term. These are the apps for anatomy physiology, and this one app I will definitely suggest you to have. It is from one Dr. Vivek Nalgilkar. Is a physiology app. So it's a physiology guru. It's a very wonderful app, and this person goes on updating the things. There is no end in telling you about different kinds of apps, but these are some examples which I am giving. It is up to you to decide what app you should use and how you should. So if you have done your first MBBS from basics, so active student, clinician, either during the examination, somebody is trying to squeeze your brain onto the paper, or now you are in your ward duties, n number of patients, and you are in charge of a 20-bedded ICU. How the thing is going to help you? So it is the main trust is on adaptability, whatever situation. In approaching a patient, how to risk stratify, how to help in diagnosis, lab work, how to diagnose with the help of simple equipments like peripherals, and how to monitor. In the therapeutics, how to prescribe, checking interaction, drug counseling, and most important, your documentation in form of electronic health records. The simple question asked by my patients relative of AMI: what is my risk of having a CV disease? So either there are too many options, vague answer based on experience, time consuming search out on the web, and certification. Option 3 is what I am going to show you. That is called as the ASCVD risk estimator. It tells you about whether the patient needs statins or not, and if needed, whether it is low dose or whether it is high dose. Let us go back. You can show a patient risk factor modification can reduce CV risk, like quitting smoking, controlling lipids, and controlling his blood pressure. So this is ASCVD skin risk estimator can be done even by a reception person. You don't need a doctor for this. The second risk stratification situation is about a patient who is having a fever, and the relatives say that the patient has worsened. Again, three options: vague answer, time consuming, call RMO. The best answer is called as a SOPA or quick SOPA test. What is the quick SOPA state? It just checks altered mental status, fast respiratory rate, and low blood pressure. With this, you can come to know whether this patient has worsened or not, and whether he needs to be shifted to ICU or not. There is no bias. There is no assessment problems when the patient is seen by 10 different recipients. Now, from clinical bedside, let us come to lab work. You have got some diagnostic tests are growing exponentially. So we have got some lab tests done either in millimoles or milligram per liter. So how to do unit conversions of it. Then there are certain battery or bundle of tests, and you should have an immediate interpretation of tests, just like either a ECG in AMI or AVG in a patient who is breathless. So this is a very good app called as a biochemistry QLR, quick lab reference. All the tests you can have screening test into that, and you can do arterial blood gas analysis, come down to the conclusion, fast decide your treatment, and specific ECG changes of the MI or ischemia. There is one Dr. Dev Pujari from Nagpur. He has got a wonderful lab references for blood gas analysis, and even it gives the diagnosis of it. Everybody requests to download Dr. Satish Dev Pujari, all the apps, especially for the pediatricians. It is really very, very important. Now, the next situation is monitoring. There is a simple bedside problem when the staff is very unsure whether the stroke has progressed or not. The same thing, you go on checking whether clinically, this is the answer for everything. This is the score for stroke. You just put all the parameters, it gives you a score, and it tells you whether the patient needs further treatment, embolectomy, atherectomy, whatever it is. In therapeutics, there are almost all diseases on the touch of screen, with seconds covers all relevant information, access to the drug, interactions, adverse effects, and cautions. In the era of polypharmacy, don't disregard drug-drug interaction, and it can be integrated in the healthcare information system. I just share one of my failures. A patient of malaria, gastritis, ischemic heart disease, COPD, and who was to get PVC was on azithromycin, domperidone, quinine, amiodarone. And the last drug which was added was quinine. And can you guess what was the final outcome? It was a very malignant arrhythmia, torsades dispointis, a patient which is cold, pulseless, prolonged QT, TDP, non-responsive to drugs or multiple DC conversions, and finally succumbed to it. A simple app might have saved her. If you can recall, I had shown you from Medscape this drug interaction gap application. You put on this, the answer would have been all these drugs can cause QT prolongation. You have to be very careful as far as the cardiac status are concerned, or reduce the unimportant drugs. These are the therapeutic related apps: RX, Merck manual, physician pharmacological reference, Hippocrates. But what is most very good and most liked is called as a Micromedex. It is from Thomson Reuters. It has been supported by IBM, and it is a very trusted source. Everybody in clinical medicine should have this app, especially when you want to check the drug interactions. Now, there are a lot many people who are asking for digital pharmacy. So this is a very doubtful situation. There are Pharmacy, Practo, 1 milligram, brown packet, MedLife, and more. But we really don't know whether they are giving quality medicines and what is the legal liability of this. So friends, technology has endorsed by many organizations that it can change the outcome of conditions like diabetes. But have you imagined your simple phone has got many hidden equipments? A good torch, Then you can connect to the stethoscope. You have got connections which can check pulse rate and SpO2. With the scale scope, you can have skin lesions. You can do a lot of remote science monitoring. The built-in mirror front camera is not for selfie, but it can be used for a diabetic patient's foot evaluation. The light of a smartphone is the most powerful, it neglected part of the smartphone. It can have a strobe effect, it can have a blinking effect, it has got a sound on off. It can be very useful instrument in case of emergency, if you are stranded or if you are in distress, especially for the female physicians who are working in the odd time. Then there can be a modified tongue depressor like this. It is a 3-in-1. It has got a thermometer, it's a tongue depressor, it has got torch. And this is a remotoscope which is attached to a smartphone. We can see the ear of the person. There can be a wireless otoscope. You just put into this. Don't go inside also, but you will be in a position to see the ear of the patient. There are list of equipments which can be attached to your smartphone. Different kind of thermometers. Because of COVID, we are all familiar with this type of guns. Then this thermometer, after temperature checked, it sends you to 5 or 7 people who are managing the baby. Then pulse oximeters are becoming very wise. There is a voice pronunciation of the oxygen concentration, and there are a lot many other modifications which are asked. These are the smart bodies weighing machine scales or composition analyzers, and they share wireless data. These all are connected together. I had a patient of diabetes. His weight gain was not explainable. And we could see the body water increasing gradually, and ultimately out to be safe with huge amount of fluid retention. So if we would have sensed his warning of fluid retention by increasing weight, we might have been in a position to help him in an early way. These are different kinds of smartphones. The smartphone which can be connected to a laptop, or this is the receiver's end for the patients, for the doctor, and the patient keeps the phone at 6 different places, and you can listen to the heart sounds. Even with the help of Bluetooth, you can have auscultation for COVID without touching the patient. What the doctor has got only a Bluetooth stethoscope, and somebody else, the medical assistant, is keeping the stethoscope on the patient's chest. There is a lot of revolution in BP apparatuses also. You can see the color coding on BP apparatuses, but in addition, this BP apparatus talks also, and it tells you the exact amount of systolic, diastolic blood pressure and the pulse rate. Very useful for the visually impaired patients. Then it need not that you should have a regular conventional pump. On the smartphone also, a BP apparatus can work better, or you can have a BP apparatus like this, which is tubeless and can be used as a even 24 hours ambulatory BP apparatus monitoring. So it's a Quadrio arm. It is a wireless blood pressure monitor. It tells you in the map also where you have been and which part, how much you have walked, and what, if you have done exercise at a particular level, how much BP has shot up. So this is a very simple 24-hour ambulatory BP monitor. Previously, it used to cost very high, but now they are as cheap as almost 30,000 rupees. And they give you 3 different types of cups also. Very strong instrument. You can definitely rely upon it, and very useful for our clinical environment. If you have got this Welch Allyn eye examiner system, which can be attached to a smartphone, you can see the retina of the patient. You can record it, and you can send it when the patient is having any problem with his vision, so that it is detected earlier, and you have got something for comparison also. This is an equipment called as the Alive Core Caradia Mobile 6-lead ECG. You have to just hold this ECG in your hand, and it will be shown. It will be visible for anybody who is connected with internet and this app for noting the arrhythmia and ischemia. This is the first FDA cleared personal 6-lead kg ECG was there, and there are a lot many players nowadays, but this is one still stands very strong. Except for the law, we cannot use this, but it is a very point of care ultrasound and 2D echo probe, which are compatible with smartphones, and you can quickly come to know what is the ejection fraction and what are the things which are going on with this, and it can be shared with your seniors or even the patient caregivers. This is a Israel company spelled as a Noga. It is a smart watch, non-invasive measurements of almost 17 bioparameters. It is a hybrid invasive glucose monitor. And if you order these particular instruments in bulk as an institute, they are available very cheap. And for the COVID patients who are being followed up in their homes, this is something really wonderful. This was my first glucometer, which I bought in somewhere in 1985. From that, the journey has ended to a talking glucometer. And there are a lot many new glucometers in the market. And we can easily say that it is a mobile diabetes monitoring. This phone was advertised as a glucophone because it is not only a phone, but it has got a glucometer inside. And these are the attachments which we can fit into the glucometer. There are lot many new pairs with apps. It's called as IBG Star, and the app is called as a GMAT, where you can get all these things on the screen, or even you can get a graph out of it. So it was sugar in the morning, and then afternoon. This was after lunch, then again evening, again a shot in the night, and that tells you on how to adjust the various type of drugs, or especially the insulin. This is the Freestyle Libre CGMS 24/7 for 14 days. Here you can pick up the unprotected hyperglycemia, unprotected hypoglycemia. A very good instrument for even seniors also to adjust their anti-diabetic drugs. But it is not the glucometer. For what matters for the patient is the pinprick. This is quite painful. It is a tri-bevel needle. It is less painful, but there are certain needles like this. These are called as the clip needles, where even you don't see the needle, and the patient is very comfortable as far as the finger prick is concerned. This is a band called as a hypo band, which detects low sugar, but it doesn't detect low sugar per se. It detects cold sweat. And for all my medicine residents who are there, there are only 3 conditions where you can get such kind of severe cold sweat. One is MI, second is GI bleeding, third is onset of septicemia, and fourth is severe hypoglycemia. All these 4 life-threatening conditions can be managed with this. Again, coming back to the Israeli people, this is a hybrid non-invasive glucometer. If you have got, and I'm not sure whether your institute has got a engineering college attached, but you can definitely collaborate all their electromechanical projects with them. And this is a very, very, very good way of scope of creating the Indian Jugaad type of equipments. This is a French watch. It is called as a PK Vitality, but doesn't not only show only glucometer, but even it shows HbA1c and how the things are changing according to the activity. Suppose if you have got diabetic foot care you want to introduce, then you just, this is simple hand mirror. You can inspect your feet daily. The picture can be taken on the phone, or you can have a weighing machine with a glass top or some 45-degree mirror, which will help to see the foot properly. So it is not always that there are a lot of money which is involved. The innovations can be as simple and as easy using your common sense in the patient care. So this is something one step up. This is a pen which talks with the glucometer and it decides the dose. But you can see the dates. It requires just 1 or 2 years to develop this prototype equipment. Otherwise, it used to be very, very difficult for all the engineers and all the scientists to develop equipments. So we must thank the digital technology which is helping us in all these kind of situations. So here the sugar is like this, then it tells you what and suppose if the patient goes into a hypoglycemia, it is warned and then it is shown on the app called as the GoCap. This helps for the people who are especially on the insulin pump. There are a lot many apps for clinical management. Very
name of UG, PG, researcher, department.
App is called as Treatment Plus. So these are the 3 possible ways in which it goes. It searches, browses, and
see,
then you can select the feature
the subject was
and
studied.
you can read whatever you want to read in
Studies
detail
are
about
included
one particular
lot of
situation. So it's giving you all the
reason.
details of albendazole, which is the drug which is to be given for different
I see the certificate.
works, and it can cause even the another utility is also secondary hyperuricemia associated with chemotherapy. So like this, there are a lot many apps. 5 minutes clinical consult, prognosis, physical examination. You have to be familiar with something, one out of it. 5 minutes medical clinical consult is a very good app. It gives you so many supporting evidences and the literature. Prognosis helps you for your clinical approval. And there are prognosis, infectious diseases, diabetes, respiratory, different types of there. It tests out your decision-making skills with a risk-free environment, assesses your clinical knowledge, and you can learn within minutes. And this is a very good app, especially for the clinical examination. So many other similar things: physical examination, medical procedures, free clinical skills, and standard dictations. If you are going to write the patient's reports, because with insurance coming up now, it is very essential for us. Even what happens in a stroke or AMI, and if you have standard dictations, what you have to just fill the name of the patient, and everything will be ready for the electronic health record to be uploaded. So this is CEME physical examination. You have to download, somebody of you should download one app and try to evaluate. So suppose if you want to know a aortic regurgitation murmur, this is the audio file. Then it will be mild, moderate, severe, and it will check the things. Atrial septal defect, without pulmonary hypertension, moderate pulmonary hypertension, severe pulmonary hypertension. All these things are very useful for learning and teaching. Now let us come down to the organizational taking. So this is a MK SAP from American College of Physicians. It is a reviews app, and for the Indian setting, you have got API app and My JAPI. This JAPI is the Journal of Association of Physicians of India. Then Hippocrates conducts lot of online CME, and they are of a very, very good quality and good take-home message, very practical points of it. You become a member, and then you get invites of the CME, you register for it and spend good 45-50 minutes in one CME, you will be definitely wiser. So these are the e-learning, teaching and educating apps, building clinical acumen on virtual patients. There is something called as a simulator. D.Y. Patil Medical College in Navi Mumbai has got patient simulator lab. Virtual consult situation, standard history and exam technique, managing patients with hands-on instruction. And in our CPD conferences, teleconferences, what we are doing right now is one of the e-learning and e-teaching process also. Now let us come down to something very vital and very important in our day-to-day medical practice. Anand, I got another 20 minutes. It is 35 minutes I have done. Can I go for another 15-20 minutes?
Yes, another 10-15. You can go, sir. Please go ahead.
Yeah. Okay. So applications and documentations in form of electronic health record. How EHR helps you? It standardizes your practice, the sound database for research, post-marketing surveillance. You can sort by any category. It helps you in medical legal aspects, and this customization and graphic representation that will help you in management of the patient, convincing the relatives also. So how you start? Simple to complex, with an Excel sheet to the established platforms like DocOn or OneGlass. You should have entries, headers and rows of columns, allot the points, fixed and vegetables. This can be entered by the patient or caregiver or staff. Choose the lab parameters. Prescription can be detached. It can be converted into a QR code also. You can identify the data and patient by specific number, and you can track the patient, and you can integrate it with entire health information system. Suppose if you have got in your medical college, you want to know how many patients of COVID had come during 2020. At a click of button, you will get the list and the EHRs of all the papers. And it will avoid these horrible problems related to the doctor's handwriting also. That is one thing where there are maximum numbers of fatalities and drug interactions. Now let us go to a quick run of things which can be attached to the smartphone peripherals like ECG. We have seen stethoscope and other things with different ports. Smart watches are used for fitness, but there are few smartwatches which detect obstructive sleep apnea. They can detect even fall. They can detect even arrhythmias. In the geriatric society, I'm going to talk on these particular assist devices only, and it is going to be very, very useful and going to make the life of the person easy. Suppose if you go out, if you fall unconscious by hypoglycemia or stroke, who is going to identify you? This is a app called as ICE. In case of emergency, all the details are there, and it works even without the password. Google Maps, AccuWeather has helped lot many people in the accidents and emergencies. We need not uh, go into the details, but I just one simple thing which I like to discuss with you is selection of the right app uses will determine the app success to the market. And it has been said that even simple texting, personalized messages are seen as one of the most easily implemented and most effective changing patient behavior, like reduction of pre-diabetes, diabetes to the best diabetes control. So these are the things which you can already you have in your hand. You have your patients. So prepare a project in which you can have half of the group without smartphone, half of them can be with smartphone, and you can see the change in HbA1c. And at the same time, if you are in private practice in the economics, realize your value, start taking money by e-wallet or even the uh, a smart way. There is no point in just getting it from the real currency notes. So we have to adapt to the change as what the whole world is adopting in last 11 months. So friends, for what will we change for you tomorrow? What are the new technologies possibilities? Try to check around it, how to do it, how does someone else does it. Check all the 5 A's. Start using simple apps. Calculate EGFR using a calculator, ACVD risk. Add peripherals to your smartphones and try to maintain electronic health record in a simple format. If you can do only this, anything out of these three, this will be really make a sea change in your practice. So learn from everybody, and you have to not be a old crow, but you have to be a modern smart crow who can get the thing done faster and better. What is there in the future? Virtual reality, advanced monitoring, improved diagnostic, lab on the chip, counseling can be, and the virtual reality can be treatment for loneliness in the geriatric group. These are the various new things which are there. This is like a electronic skin. In this electronic skin, you can get parameters like glucose, sodium on this screen. This goggle, if you can see just above the mask, is called as a Google Lens. It gives a 3D effect, and whatever the person is doing can be watched by practically anybody in the world with the help of internet. This is a virtual reality where you can assess the changes which are happening after the surgery, and lot many new things are there. This is a pendant, looks like a pendant, but it is a fall detector. This is a electronic waste, which is a arrhythmia detector. These are the small skin patches, and then you can order even the organs depending upon your requirement, and it can be done by 3D printing. So as an institute or as a physician or as a healthcare system, if you want to implement digital healthcare system, these are the few tips. Early investment makes it adaptable. Affordability and scalability are prioritized over the platform integration. Providers can be successful by building first and refining later. Employee wellness is the most important thing, and emergency drives broader innovation. We have to consider all these factors whenever you are implementing the electronic healthcare system. So these are the lot many new things which are coming. IoT is Internet of the Things, blockchain technology, voice recognition, virtual reality, and most important, but of all the things, the main problem is cyber security, which you have to be very much careful about it. I'm just going to give you last two slides about the references which you can use. That is the Nature Partner journal called as a Digital Medicine. And this is, you can see the subjects, how the IT preparedness helped to create a digital field hospital for the care of COVID patients in South Korea. It even some odd situation like firearms in USA, or what are the sleeping patterns which are associated with unavoidable problems. So this is a very good journal. Your library can subscribe it. Actually, for the libraries, it is free. And this is JMIR publication, Journal of Medical Internet Research. You have got journals on protocols, U Health, M Health, informatics, surveillance, mental health, formative research, serious games, and in this is Journal of Medical Education also. So friends, ultimately it is the best jewelers who are not only dexterous across both technology and their bench and brain, neither will ever completely eradicate others. So you have to use your clinical acumen, you have to use your technology, and you have to use your personal skills in communicating with patients so that you get the best results. So let us be ready for the technology of future. There are a lot of many things which are going to come, and this is called as a augmented reality, virtual reality, mixed reality, or immersive reality in healthcare, and artificial intelligence, big data, cloud computing, data mining and retrieval, EMR with future readiness. These are going to be the main key players. I will not call it as artificial intelligence. It is the augmented artificial intelligence with the help of any technology. Before we close the smart chapter, we have to, I cannot forget few people who have helped me and encouraged me. Is my teacher, Dr. Soltur. Many of the old timers of Bijapur may be knowing it, and many of the patients used to come to mirrors. So for the next generation, opportunities are endless. It is up to us how to take and use it. Do not get lost in the maze of apps or trapped in the cobwebs of internet. Aim at what you want and respect your teachers and experience. The clinician's role prevails, technology changes, advances are welcome, but human touch, rational thinking, clinical acumen, empathy are non-technical and will definitely always win. You have to combine wisely, keep learning, think for the people of our motherland, customize out. This is a very good reference book for all of you. This autobiography of Dr. R.D. Lele, Pursuit of Excellence. He has written two textbooks on technology in medicine, and he is still going strong at the age of 93 in Mumbai. So, friends, I stop here, and most welcome to share your questions, your suggestions, comments. I also welcome my friend from Pune, Dr. Narayan Karni. He's an orthopedic surgeon, but he's a very strong activist of medical legal science and a very intelligent student from our alma mater. Narayan, welcome for the meeting. Anand, it is over to you. And if I'll see the chat box.
Yes, sir. Sir, thank you very much for that excellent insight. And what was very good about the talk was many things were unknown for us, and you have instilled the newer technologies, how a simple mobile phone can help doctors and newcomers, especially, so that they can have a better decision taking capacity at the bedside. So I agree with you that this is not a replacement for our clinical skills. It is only a aid to help us, especially in time of emergencies. And very important thing that you are told is to update ourselves. And sometimes during emergencies we may not find our colleagues to help us, where these apps can at least help us to find the formula. And as you mentioned rightly, that major complications like drug interactions can be avoided using these apps. And much more importance has been emphasized by you regarding the use of simple mobile phone that we carry in and out every day. As I mentioned in the introductory speech, that yes, we are underusing our smartphones. And I think with listening to your talk and the experience that you have shared will definitely make us to use our mobile phones in the better way. Sir, we can take some questions now.
Yes, yes, no problem, no problem.
Yes.
Are you using any electronic health record, Dr. Anand?
Yes, sir. We have started, our university medical college has started recently to produce an electronic method, and we have, it is in the nascent stage. It is coming up, sir. And all the OPDs have been connected with the LAN, and the drugstore, blood bank, laboratory, and radiology all have been interconnected. And just at the click of the button, we get the reports on your mobile phone. That is what is exactly happening
Yes,
now in
yes.
our institute. Yes, sir. And I like just to inform you that we do have an engineer college with our association, and you rightly mentioned that we need a collaboration with them to develop some gadgets. And secondly, we have students from pharmacy college also,
Yes.
and that was a big advantage for them listening to you, and they are very happy here. We almost have some 50 students here attending, including postgrad students and faculty from respiratory medicine and general medicine along with me. I think we can take questions of those who are online. Dr. Sandeep Khare is asking about the copy of your talk.
Yes, it is. I am going to mail you immediately. I'm going to mail you immediately.
Okay, Sandeep Khote, sir. Yes, and Dr. Prashant has congratulated you for the nice presentation. And I just now received a call from my Honorable Vice Chancellor, Dr. M.S. Biradar, sir, thanking you for your talk and being with us, with our BLDA family. For it is definitely a privileged moment. Also, my principal, Dr. Arvind Patil, had just called me to convey his sincere thanks to you for being with us. And we will wait for some more questions. Any questions from the audience?
Thank you. So, Anand, what you can do is,
Yes, sir.
you can take some aspect of the patient care.
Right, sir.
For example, acid-base balance,
Okay.
and ask one or two students to prepare that topic and present as a 10-minute speech.
Okay.
That goes in a good way. Means
Fine, sir.
using social media in diabetes in your
Right, sir.
regional language. If you have got a college of nutrition and nursing, then
Yes.
identifying the carbohydrates and identifying the various different kind of foodstuffs, that
Right, sir.
becomes very easy for them.
Okay, sir.
It is
I got it.
a combined effect with everybody.
Yes, sir. Definitely, sir. And we here are also with the help of the pharmacy college students and the faculty. We are having interdisciplinary geriatric medicine and the general medicine students have an interdisciplinary CME on, especially on the drug interactions. So I think the apps that you have mentioned now will definitely benefit our postgrad students as well as the students of the pharmacy college. So if there are any other questions.
For the pharmacy students, you can prepare them some clinical situations like this. Suppose if the person is having a sensitivity to sulfonamides, and by mistake, if somebody enters a sulfonamide into the prescription, then it should give a red signal that be aware the person may be sensitive to this. And you have to make the list of the drugs which are sulfonamides, because
Right, sir.
some people who are diabetics and those who are sensitive to sulfonamides, they develop problems with sulfonylureas also. It has not been confirmed, but we should avoid drugs like this which can cause potential problem, like G6PD deficiency. The G6PD deficiency person should have a card.
Yes, sir.
You can ask your IT people also to give a digital card to each and every of your patients.
We are in the process. We are giving, sir, already.
Yeah, and now that should be part of his screen.
Yes, sir. Yes,
If
sir.
diabetic person is moving out and if he falls unconscious, at least without unlocking, the person should be in a position to contact the hospital.
Yes, sir. You're right, sir. Yes, sir. That is in the process of now. Already digitalization is taking place, and we are in the process, sir. But what the things that you have mentioned, it is just excellent insight, sir, on the utility, how best we can use the smartphone in for the benefit of the patients as well as the learning things. Especially, we are very lucky and privileged to have you, despite your busy schedule. You are with us for this 1 hour, and I like to congratulate you that we had an excellent quality of your video as well as the audio system. We never faced any problem in last 1 hour. It was so good, and there was not a single second of drop in the voice of yours. And we appreciate for that. And I now hand over to our head of department, Dr. Sanju Bentur, sir, for his presidential remark.
So thank you very much, sir. It's
Thank
understood. Thank you very much, sir, for your elaborative talk on the smartphone usage in the health professionals. So here, my one request is regarding the optimization of the use of these gadgets in professional course, because where we should restrict ourselves for the utilization and dependency. That is my this one request you to. So I request you to have one more session regarding the elaborative aspects of these gadgets, because it's much more, it's like a ocean, sir. We never knew that it is so much widely used in the medical profession. So me and Anand, some other time in due course, will check out to restrict ourselves to the medicine, sir. It's my request to have one more talk by you, restricted for physicians.
Definitely.
Ah.
We'll take some 7-8 aspects. I will first mail to
Yes,
you.
sir.
There are
Yes,
some,
sir.
like what you said, that there's a digital toxicity also there for a lot of people. There are
Yes, sir.
persons who see screen for 7 hours, 8 hours, 9 hours a day.
Yes, sir.
So there is an app for that also.
Yes, sir. So very thankful to you, sir.
I'm really
And
happy all your PG students were there, and
right, sir.
we can be together for such types of academic activities. You please do archive this lecture and distribute it freely to the people who want to see it. And
Yes,
Anand,
sir.
I'm
Sure.
sending presentation also.
Yes,
Except
sir.
some
Sure.
personal slides and photographs, it will be there.
Yes, sir.
Yes.
Understand, sir. Yes,
Okay.
sir.
Thank you.
Sir, any questions? Any pharmacy students who wish to ask questions? Okay. Or you can mail him. He is very immediately he can answer to your queries. Okay, sir. Not to take much of your time. Yes, please come, sir. We have Dr. Vinay Kulkarni. He is a consultant physician in the respiratory medicine. Please come, sir.
Please
He
come.
wants to ask some questions. Please.
Any apps for statistics, sir? Easy understanding.
Yeah.
He wants to know, are there any apps for easy statistical analysis?
Yeah. You can take out your mask, no problems. You can take out your mask. See, you have to go to the research analysis. You just type medical research and analysis apps. You send me your email. I will send you the screenshots, because there are a lot of apps and there are various different subjects are there. And what is in your mind? Do you want to present a paper, or you want to have a just an overview?
Both, sir. Both for understanding.
I got a separate presentation of that. I will send you the things, definitely. But the first step, which I will tell you, what you can do is that you select a good electronic health record, or just prepare very strong, very robust Excel sheet of your database, so the data can be interchanged in any way. Okay. There are a lot of apps which help you in getting down the references in a proper way. And if you have got an institute ID, you can become a member of ResearchGate. Research.
Yes, sir. We are the members, sir. Yes, we are the members. We are the members of your one.
I got my son is next to me. I'll just ask him what the other research apps he must have been using. What are the apps now, sir?
Sir, yet academia.
There is one called as Academia.
Yes, sir.
And bioinformatics and medical statistics, it is like having a bike of your choice, to tell you very frankly. You first define your proper situation and then see the different types of apps. There may be one app which will give you the best fitting answer for that. There is nothing like a perfect. Otherwise, there will be just one general medicine app. You can put everything there and you get the information. But here, it's a collective wisdom of so many people. I will send you the details. You please text me your email ID on the chat box.
Yes, sir.
Okay. Thank you very much.
Thank you, sir. Thank you very much, sir. Now I take this privilege to thank you very much for sharing your knowledge and experiences with us. And I think that whoever has told you that 65 में आप क्या कर रहे हैं, in fact you are doing more wonders and bringing the technology to the new generation, and that is very important. And as you rightly told, that there are many apps which are like an they are projecting as if they are very good apps, and our students, they fall prey to it without knowing what exactly or how best to make use of it. You have rightly mentioned how best to make use of the apps, and always go for the original ones and not just by the color and the attraction that it produces. So I take this opportunity to sincerely thank you on the behalf of BLD Deemed University family, and I also thank our Vice Chancellor Sir, Medical Superintendent Sir, Head of Department, Vice Chancellor Sir, Principal and Vice Principal Sir for their support. And of course, special thanks to all the audience for being with us offline and online and also on the YouTube. So thank you very much. Thank you very much, sir, for your sharing your valuable inputs. Thank you very much.
Before leaving, I just give you one more tip for the day. You take down the name of the app called the Brainscape.
Okay, sir.
Brainscape. I'll put it in the chat box.
Okay, sir.
That is one of the biggest learning app for both the students and teachers.
Okay, sir. Thank you very much, sir.
From which you can prepare many slides. You can have a real case-based discussion, everything.
Okay, sir. Okay. Thank you very much, sir. Thank you, sir.
Thank you.
Thank you, sir. Thank you very much. Thank you.